And then, I've learned as much as possible, you make your voice as even as possible, especially if you're the veterinarian. Like they feed on your energy. So if you are panicking, they will also feel your breathing rate. They will also feel if you are nervous. So and I don't know if sa inyo hang mabantayan with my voice right now, but I'm making it as calm as possible. Now, when you're going to do physical exam, you start from the head and then you end with the tail. So, first, we have here the mouth, and then showing her teeth. Okay. Yes, baby, ayaw lang. Also, you check for the lymph nodes here, the mandibular lymph nodes. It's all okay. Small movements also help. Okay. So the lymph nodes are here. It's not palpable. And then you move down. In large animals, it's beneficial to never remove your hand. So let's say now I will remove my other hand. My other hand is as flat as possible in her body so that she will know that I have not left her. Good girl, good job. So that's her trying to cope with being anxious. She's shaking her body, so praise her for that. And then, so good job. And then if I'm not touching her whole hand, my both hands to her, I am intentionally also pushing her towards my body so that she can know that I am not moving away. No, diba? Okay. So I have checked her mandibular lymph nodes already. I will move back. Yeah, here you have your axillary lymph nodes as well. Yeah, so as you can see, while I'm removing my hand, so here, move that, and then so big hands. Good job, good girl. Okay. Yeah. If they are moving as much as possible, we try to start with minimal restraint first. So I know she's not showing aggression, that's why I'm just letting her play by with my hand. So this is the spinal column, okay. And then if you check for dehydration, so this is what you call skin turgidity. Normally, if you are well hydrated, it will return back to original position. Sorry, that's not for patients. So I check now for returning immediately. And then, so start from the head. Mana po sa iyang legs, go back. And then if you're going to check for, I'm also at the same time checking for any masses. So if any grow. So that's why you should touch them a lot. No, baby? Okay. Yeah. You drag it back there. Then, so check there. Yeah. So, naanad na ko, so I don't. So I'm positioning her head because I'm doing this by myself. I am pinning her head in between my hand, and then I'm going to lift. I'm also checking her paws, guys. This is the classic hiding place for your ticks. Yeah. So I also actually check in between her digits in the front. Yes, B. Okay, very good. And yeah. Dali, show them your palpebral reflex, B. Yeah, mucous membrane. So, as you can see, my whole arm is against her back. So, para ma-feel niya. And then, here, you should use your body without. And show your gums. Oh, di ba the color is pink? Pero, it's not pigmented. Some animals get pigmented manilang gums. And then, to check for the CRT, when you say CRT, capillary refill time, is a measurement of good circulation. So, you press the gum. It should return within 2 seconds. Actually, ideally, you're using the exam gloves. You could ask for a box sa office. Ma-feel lang ko yung heart rate right now. It's already increased. Yes, baby. Good job, good job. Good job, Manasha. Yes, okay. And then, when you're going to do neuro exam, ideally, they are relaxed. Pero she's definitely not relaxed. Yeah, how do you? So, you usually do that. Baby, lagi you're annoyed na. So, she's not a good model for that. Okay, dapat. Let's say, no, example lang. Gani, I will fold this. That is the normal reaction. So that's what you call proprioception.
Oh. Yeah.
Dili lagi siya pwede. You check her HR. So with your stethoscope, diba this is bent. No, it's supposed to be bent. The bend should be going forward. Kaya tanawa, see, she is still nagsandig. Her body is still against mine. So that will reassure her that I'm still here. And then, where is the heart located more? Right? Left. And then, here. So, it's between T3 to T4. Ideally, your patient is standing. So, ideally they're standing and then you place it here around the elbow. Ay, ikapoy naman na siya. Uy. So that's your heart rate. Nakabalik yan. For her stethoscope, this is rotated. Okay, ka? Some stethoscopes, you can turn the node here. So, where you find the circle, that's where you can hear the auscultation. So, at first, when I directed this side towards her chest, I could not hear her heart rate. So, dapat dili. If it can be rotated, you check your stethoscope. The indicator here, so it's pediatric and full growth. So can you You already know how to count the heart rate. So sometimes you don't need to count the whole minute. Okay, about 1 minute 60 seconds. So what you can do is just 15 seconds and then times 4. And then breathing rate, you count the rise and fall of the chest. Oh, so many audience. So many sila. Oh, popular ka ba? Oh, okay. And yeah. So that's the head to tail. And then for giving oral medication. So if you, I forgot actually to bring a tablet. So I was thinking of buying Skyflakes niya. So you're going to slide tablet here into her tongue and then push it there down to the throat. Wala niya ito. Wala. Okay, sorry. Isang wala gani. And then for the syringe, so you. So for the syringe, if you're going to get a liquid here, make sure. Now for her, she will bite it naman, no? So you can just push it there, no? Because she's biting it, might. Or if not, then hello. I like to look them at the face. I'm the one doing it. Yes, it's me. And then na may gap sa iyang teeth here. There's a gap. And then you can use that to grab. Yan. And then, okay. Good job. Charms of hangin na ganito. Okay. And then for subcutaneous, when you are going to administer, since this is injection, it's not a vaccine. If it's vaccine, there's a debate whether you use alcohol or not. But in general, if the skin injection site is dirty, since you're going to inject, just make sure it's really clean. But if it's a live product, a biological, live man, that's why we keep them in the refrigerator. If you still remember your COVID vaccines, you will apply alcohol, but it needs to be dry before injection. But when it comes to medical application, like for antibiotics, like the fact that so it's okay if you do not dry the alcohol, yeah, it's still wet. Pero if it's a vaccine, biological, you will, okay, sige. kung let's say, no, this is truly anxious and aggressive patient, it's not recommended to be doing this in front of them. Sabi na lang kay Dili, sige, check na lang. No, okay, sige. Dahil yun, when it comes to IM, intramuscular, subcu first, you inject, the location doesn't matter. You could apply it here, subcutaneous one. So, take note lang, not all medicine are safe for subcutaneous administration. So, some will cause hematoma and will cause a reaction if given subcutaneous. But today, what you will be giving is only, will only be NSS. So, NSS is not medication, it's simply fluid. So, are you looking for a treat?
Dapat na di pa treat mo. I'm
Sorry. And then when it comes to IM, we have 4 locations for our patients. Here, it would be your triceps.
Wait lang, wala. Dili lagi ito mag-inject once.
Oh, baby, actress na ka. So here, put it here. I will demonstrate it to you once again. Or sa nice. So what's important is that you pinch the muscle so that you are sure that you're administering it to the muscle and not to the fat. And then the direction of your needle should not be, you have the bone here, so you must direct it away from the bone. And then pinch it so that mabulge yung muscle.
Okay. Good job. Ano na, human na ka. Yes.
As for the ear, it's good practice, Manggod. Although you will not be applying anything to the ear this morning to get used lang to apply it. In the practice, it's one of the difficult medications to do in some. So, make sure you apply it on the ear canal itself.
Yan, ganahan na lagi na siya. Okay na ka? Okay, good job.
Sige. Are you okay? Sige then. I will not do the rectal exam lang. Okay, let's do it once lang. With you lang. Okay.